What is up, guys? I hope you guys are having a great day so far. Um, so I know we only have 2 days this week, so I kind of wanted to just take the time real quick to go over the chest, back, and then the legs, and then I'll let you guys go over the arms on your own and see what questions you guys have. But make sure you guys just pick up the handout that's at the front of the room for the arms. Otherwise, we'll get the rest of our information from chest, back, and legs here. Okay, so starting off with our trapezius muscle. So our trapezius muscle, if we look closely again, if we're looking up towards that origin point, that is going to be close to that occipital bone where it's attached. We will also see it along the cervical and thoracic vertebrae here. Then the its overall action, as you might be able to discern here, is to rotate our scapula. So again, our scapula is located right here, where it also looks like the wing of our back, and helps raise and lower our arms. Next, we have is our rhomboideus muscle. This is it right here. So our rhomboideus muscle, its origin is again those cervical vertebrae. And its action or function is to rotate, elevate, and help move the scapula up and down. Next, we have is our splenius capitis. So we're going to see this along where its origin point is also going to be identified as that thoracic bone. So again, our thoracic vertebrae. And then its insertion point is up at the skull instead, at that mastoid process, again, essentially right below your zygomatic, along that temporal process. But with this guy, what this muscle helps do is helps rotate the head, bends it from one side to the next, and helps keep it in an upright position. Next one we'll have is our teres major. So what this one helps do, it helps extend our humerus, so it helps extend our arm outward and helps rotate the arm medially, so it helps rotate that arm inward. Next we have is our latissimus dorsi, this whole muscle right here. So its origin point, it's going to be located along our thoracic and lumbar vertebrae, but then it also extends down into that iliac crest of our pubic bone. Whereas its insertion point is located right along the grooves of our humerus. And this muscle, again, it helps extends and adducts the arms, by rotating that humerus internally, and helps pulls the shoulder down posteriorly. Next thing we have is our supraspinous. So what this muscle does, again, we are looking primarily at this muscle here in this darker blue. So this muscle is located on the posterior surface of your scapula, which again, the back surface of your scapula, and its insertion point is at the humerus as well, and it acts as another one of those secondary muscles to help move the arm. Next thing we have is the infraspinatus. So again, this one's also located along that posterior surface of your scapula. So again, your infraspinatus and supraspinatus are essentially right next to each other. Now, if we're thinking about that prefix infra, so infra, again, all that essentially means is beneath or below, and supra refers to above. So again, supra refers to above, whereas infra refers to beneath or below. So again, your infraspinatus is um, also located at the greater tube, at the greater head of your humerus, where that's attached at. Again, also helps rotate the arms laterally. So now let's next take a look at our deltoid. So again, we're beginning to kind of notice a trend here where a lot of our origin points on a lot of these muscles in our upper back and really even down in our lower back are, or a lot of their origin points are the spine, the scapula. So they're either the scapula or the humerus. So keep that in the back of your head as you were thinking about that. It's really just their insertion and actions are just slightly different. Um, Now with our deltoid again, it helps flex our humerus, but it also helps abduct your arm as well. Now again, take a minute. What is the difference between abduction and adduction? So again, abduction is referring to moving a limb away from your body's midline. Adduction is moving it towards your midline. Now, with the triceps brachii, that would be our next muscle that we can see posteriorly. So again, we have three different heads based on the terminology of the name. I have again 3 lateral heads located in our arm. Again, brachii refers to arm, and again, this one extends down the forearm into the elbow. Now our gluteus maximus. So next we have gluteus maximus and our gluteus medius. So both of which help deal with thigh extension and overall movement, whether that's external rotation, abduction, or adduction, or even just moving it medially. The only real difference is it is the exact insertion point, or I shouldn't even say insertion point, because again, if you notice this, if our insertion point, if we were to go more distal down towards the legs, then we would begin to notice that it is its insertion points at the femur, again, our longest bone in the body. And then finally, our serratus posterior. With this one, its origin point is going to be at the supra, again, above the spinal ligament and spinal process of our lumbar vertebrae. And its insertion point is it's the upper borders of our ribs 2 through 5. So again, where it extends all the way out up through close to around ribs 2 to 5. And all this muscle does is it's really important for helping elevate our lungs and with that, and then the use of of our diaphragm muscle to uh, help with inflation. So take a minute, make sure you're coloring these all in, but that is just another view of what these all look like. So at this point, I would pause the video to make sure, again, you are coloring these all in and labeling them to the best of your ability. And then feel free to rewatch what is already recorded to get the rest of your definitions from. Definitions, action, insertion, or origins of any of those. So here's just a more definitive view of all those muscles, of what they look like, and hopefully this picture might give you a better understanding of what exactly you would need to know and where their insertion and origin points are. Okay, now kind of rounding out the back, I want you to see if you can identify terms 1 through 8. on your own without. Try your best to not use your notes. Okay, so let's go ahead and switch gears and talk about the chest. Let's talk about the chest. Okay, so starting off with our sternocleidomastoid. Again, we talked about this a lot within our within our slides about the head and neck. Let's take a look at it from this point of view as well. So again, your origin is going to be roughly around where again your sternum and clavicle is, and its overall action is to help flex that muscle and laterally rotate the head. Next, again, we have our pectoralis major and pectoralis minor. So again, differences between the two, again, are primarily based on size. So pectoralis major, again, it is responsible for that adduction and flexing of your humerus, whereas your pectoralis minor, again, really just acts as a secondary muscle, but again, it's located beneath your major and it's smaller in size. Next, let's take a look at the deltoid again. Deltoid. So again, your deltoid, again, its origin point is going to be the scapula, the scapular spine of the clavicle. So the scapular spine in the clavicle, and it helps, again, abduct your humerus. Next, you have the rectus abdominis. Rectus abdominis. So again, this muscle, again, it is origin is the pubis, the pubic bone, and it helps flex our vertebral column. Helps flex your vertebral column. And then our transverse abdominis. So what this essentially, so your all that this essentially does in your serratus anterior is it helps lift the ribs and it helps assist with, again, breathing. I know we talked about this a little bit in the earlier slides, but again, it just helps assist with breathing. And then your external and internal obliques, again, those are also responsible for flexation and rotation of your vertebral column. All right, so again, take a second. Make sure you are coloring those in. So again, at this point, I would pause the video. So when we're talking about our abdominal muscles, so it's all primarily just based off direction. So if I'm looking at each one of these different terms, so your oblique muscles, again, are primarily located at a slant. So if we're looking at these, we're really looking at the direction of the fibers. So again, your external and internal oblique muscle fibers are kind of moving at a slant. Then your transverse, your transverse abdominis. If we're looking at those muscle fibers are going from one going from left to right, one midline to the next. And your rectus abdominis muscles, those are all going straight up and down vertically. So again, we have our anterior view of our chest, so the front side. Again, see if you can take a second to identify those. And then a little bit more distal view, so closer down to our midline. All right, so at this point, let's go ahead and switch over to the legs now. Let's switch over to the legs. Okay, so starting off with your hammies, the hamstrings. So within these muscles, again, we're starting off with this semi-tendinous. So its origin point is the ischial tuberosity. So again, your ilium and ischium are essentially this little hoop-like looking structure in our coxal region. So again, what the semi-tendinous helps do is helps flex your leg and extends the thigh. And then your semi-membranous, um, it's also located around that ischial tuberosity too, and it's again also helps extend and flex the, the leg and thigh. And finally, you have your bicep femoris, again that huge muscle that we often associate with that we often associate with our hamstrings. And this muscle, um, all this muscle really does is that it also helps flex the knee and then extend the thigh. So again, collectively, they all help extend the knee, and flex the thigh, and serve the same similar overall functions. So again, there is that tuberosity of our ischium that what we are referring to here. All right, so let's take a look at the gluteus medius now. So the gluteus medius here on purple, this one's going to go up to the lateral surface of our origin point with our ilium, and it helps abduct and rotate our thigh medially. Then our gluteus maximus, so again, are the bigger of the two. So again, this one helps extend the thigh, and its origin point is located right at that sacrum and coccyx of our tailbone. So we're going to skip over the semi-tendinous, but the tensor fascia lati. So again, we talked about fascia a little bit. Again, it helps make the connection between muscles. But with this muscle in particular, it's located where its origin is at the anterior iliac crest, and its action is to help. Again, its action is to help abduct, flex, and rotate the thigh laterally. Next one you have is your gastrocnemius. So again, we're going to skip over these because we already kind of hit them. Your gastrocnemius is again is looking at the origin that's laterally medial, at the lateral and medial condyles of your femur. And all that really refers to it. It refers to like the grooves and longer heads of a bone. And what it is responsible for is that plantar flexation of your foot and flexation of the leg at the knee. Next, let's take a look at the soleus. So again, this one, its origin point is at the head and shaft of your fibula and posterior surface of your tibia, and its action also to help plantar flexation of your foot. And finally, we have that tibialis anterior. So this one is also has an origin point up at the tibia and fibula, and its action is very similar. It helps plantar flexation and inversion of your foot, but also supports your arch. So again, what I want you guys to do, make sure you're taking a quick second to color these in. Now, see if you can identify any of these ones. Okay, now the anterior view of your legs, your anterior view. So this is something we will actually cover a little bit more when we get back from break. So just really what I want you guys to go ahead and do now is go ahead and focus on just the posterior view of your legs, and then the chest and back, and then we'll cover the anterior view when we get back. But all in all, hope you guys have a great Thanksgiving, great break, and I will see you guys soon.